just to introduce myself, my name is Madhava. I am board certified in internal medicine and addiction medicine. I'm also a certified practitioner in functional medicine through the Institute for Functional Medicine. And I currently work at St. John's Riverside in Yonkers in an inpatient addiction treatment program for both rehab, detox, and we also have a methadone program and a few outpatient programs. So I've titled my presentation, Balancing Brain Chemistry for the Effective Treatment of Addictions. So we're going to just quickly talk about what addictions is and the new terminology, substance use disorders. And we're going to look at addiction through a functional medicine lens, and then addiction and brain-body imbalances, and why balancing brain chemistry is important. So as you may know, we have about 20.3 million people with these addictions listed, which is alcohol, about 15 million people, illicit drugs, about 8 million people, and then heroin use, about 500,000. But this only lists some of the use disorders. There are many more, like cigarette use, that's not listed here, and a lot of the process addictions like gambling and other kinds of not use disorders. They call them process addictions that are not listed here. And as you may know, the statistics for drug overdose deaths are pretty high. This is from 2017. About 70,000 Americans died from drug overdoses. A lot of that is due to opioids. And I think it was decreasing the last couple of years, but I'm not sure after this COVID pandemic what's going to happen. And this is the new definition for addiction. It's not called substance use disorder, and it's categorized into mild, moderate, and severe. And there are 11 different criteria. And if you only have 2 or 3, it's considered a mild use disorder. Moderate is if you have 4 or 5 criteria. And severe is when you meet 6 of these criteria, and that's defined as an addiction. So you can have a range of use disorders from mild to severe. And this is what they use for diagnostic purposes. And the way NIDA, which is the National Institute of Drug Addiction, which is one of the NIH agencies, they basically have a simplified definition of addiction, which is compulsive drug use that continues regardless of negative consequences. It usually starts as the voluntary use and then progresses to a compulsive use. And they do acknowledge that it causes a change in brain function. And this change in brain function also leads to dysfunction in behaviors. And then if you actually look at the brain using different scans, this is called a SPECT scan. It looks at brain function. It's not like your standard MRI or your standard CT scan, where they're looking at the physical structure. This, you're actually looking at the brain, how it's functioning. And so these holes are showing that there's decreased blood flow. And this is for almost any addictions. This particular picture on the right-hand side is for an opioid use disorder. You can see these holes, which are really not holes. Like if you do a CAT scan, you won't see it as holes. This is really showing that there's decreased function in these areas of the brain. You can look at that compared to the left-hand side, which is the normal scan. And as I said, you can see this in any kind of chronic use disorder. So no one is actually doing brain scans. So, you know, we're not actually seeing this. Dr. Amen, this is from Dr. Amen's files. And he has several different scans of patients with different use disorders. And as we know, use disorders affect every industry, there's no one spared. And this is just showing from the food services industry down to public administration. This comes from another federal agency called SAMHSA. And this is the standard of care right now for treatment of use disorders. So you can see for alcohol, we have 3 medications that are FDA approved. And then we have all of these different behavioral therapies. And CBT stands for cognitive behavioral therapy. Then you have contingency management, motivational, and then other kinds of therapies for addictions. So we have 3 medications for alcohol use disorders. We have 3 for nicotine. And then for opioids, we have methadone, buprenorphine, and naltrexone. So for cocaine, there's no FDA approved treatments, but some people use NAC or disulfiram. And then for marijuana, we have a couple of, again, non-FDA approved treatments. And for benzos, it's usually a slow taper. Any questions so far?
No, no.
Okay. And so this is the standard of care right now. So this is a study that was done in New Haven, Connecticut, an addiction treatment program affiliated with Yale University. They looked at about 900 patients at the start of the year. And they looked at, over the course of the year, these patients were given the standard of care, which is medications or some of the behavioral therapies we mentioned. They looked at folks who are using cocaine, marijuana, opiates, or alcohol. And what they found at the end of the year, 350 days, is that only about 25% were abstinent from drug and alcohol use. And if they were given medications, about 35% were abstinent. So you can see that our current therapies are not that effective if abstinence is your goal, if you really want to have patients stop using their drug of choice. So the rest of the presentation is looking at the root causes and seeing that perhaps if we address some of the root causes, we might have better treatment outcomes. So functional medicine looks at the root causes. That's their paradigm, is to look at the why and the how of whatever the presenting issues are. So here we can see the tree. The tree branches and leaves are diagnoses, things like anxiety, high blood pressure, thyroid disease, or diabetes. So all of these conditions or diagnoses have root causes. And the root causes have names like nutrient deficiencies or imbalances, physical or psychological trauma, or lack of sleep, or toxins, or poor digestion, or inflammation. So those are the root causes that manifest as these symptoms and diagnoses. So if we look at an example like depression, so typically if you go to a doctor for depression, they'll treat you with something like Prozac or Paxil, Celexa, all of these medications. But when you really look at what else could be causing depression, you can see things like omega-3 deficiencies, or a low thyroid dysfunction, simple as a vitamin D deficiency, or pre-diabetes, or antibiotic use. All of these can lead to a symptom of depression. And so if you look at a root cause like inflammation, you can see many things that can manifest different symptoms and diagnosis. So inflammation can cause depression. Having inflammation can cause arthritis or cancer or diabetes. So you can see how if you look at symptoms, there can be different root causes. And if you look at root cause, if you don't really address the root causes, it can manifest as different conditions. Mm. So this is a chart that actually comes from NIDA, the National Institute of Drug Addiction, a branch of NIH. And this is what they say leads to addiction. So they say addiction can be from the biology of the individual, genetics, along with the environment, and they interact with each other, leading to a particular drug of choice for the individual. And the drug affects the brain. And once you have changes in the brain, that can lead to addiction. So this is their chart, and they say that you have all of these different factors. And this is like a functional medicine paradigm where you have different factors leading to addiction. So how do drugs affect the brain? So the drugs alter the way brain cells communicate with each other. So that's at the level of the brain. So drugs can alter the way people think, feel, and behave by disrupting brain cell communication. So these are two brain cells. You can see on the right, this is one brain cell. It looks complicated. They have all of these projections going, and this is the second brain cell. The way these two brain cells communicate is at this area called the synapse. So the brain cells don't actually touch each other. They communicate via these chemical messengers called neurotransmitters. So you have a signal, which is like an electrical signal that comes down the nerve cell. And then you have release of these brain chemicals called neurotransmitters. So these neurotransmitters are stored in these pockets here. Once the message, this chemical message comes down the brain cell, these neurotransmitters are released at the synapse, which is the gap between two nerve cells, and it docks onto this receptor. And once it docks here, messages are sent to the next nerve cell. So you have different kinds of these neurotransmitters or chemical messengers, and they have names like dopamine. Everyone's heard of dopamine. You might have heard of endorphins, the high that you get from maybe exercising. And then serotonin, which is the medication that they give tries to increase the amount of serotonin, things like Prozac and Paxil. And you have all of these other GABA, you have all these, we have hundreds of different neurotransmitters. These are just 8 of the maybe more common ones. And so here what happens is each of the different drugs affect the neurotransmitter system in a different way. So alcohol can affect the GABA system, the GABA neurotransmitter, or the serotonin or the glutamate system. And the effect can be different for different people. So for me, if I drink alcohol, maybe it affects the GABA system. For someone else, it could be the serotonin or the glutamate system. But eventually it affects the dopamine, because dopamine is our motivation, it's our reinforcement neurotransmitter, and it's also the neurotransmitter that people say gives them the high. So eventually all of these drugs affect dopamine because that's what causes the reinforcement, right? So nicotine affects the acetylcholine system, maybe the endorphin system. Heroin affects the endorphin system and then the dopamine. And cocaine directly affects the dopamine system. And then these other ones. So that's how the drugs affect the brain, is via these neurotransmitter modulations. So I just wanted to show in detail what happens when someone takes cocaine. So figure number 1 here, this is one nerve cell right here, and this is the next nerve cell. And this gap is the synapse. We saw this before. So you have a signal coming down, then when the signal gets there, you release these brown bubbles, which are dopamine balls, into the synapse. So once you have the dopamine being released, some of it docks to this next nerve cell. This blue is the nerve cell, docks on the receptor of this nerve cell, and this orange glow shows that it's now going to propagate this signal. So you have a certain number of dopamine being released. Some of it is taken back into the sending cell. Some of it is degraded down here, right here in the synapse. So in the second picture, when someone is taking cocaine, which are these green balls, what happens is it blocks the amount of dopamine that goes back into the sending cell. So in effect, you have more dopamine in the synapse. Then you have this orange glow. Instead of having one orange glow, right now you have 2 because you have more dopamine in the synapse. So the patient gets this high feeling. They feel really good. So it reinforces this behavior because it feels good. But what happens is over a period of time, the brain says, wow, this is too much dopamine. I can't deal with too much. It's almost toxic to the brain, having too much dopamine. So it decreases the number of receptors in the brain. So instead of having maybe 4 or 5 here, you have only 2. And then the brain also decreases the number of dopamine that's going to be released with each signal. But the patient here feels fine because you still have the cocaine. The patient is taking cocaine. It blocks the amount of dopamine going back into the cell. You still have the one signal here like you did in the beginning. So this is when the patient says, I just feel normal when I take the cocaine. I don't get that high anymore. So you can see that even though they're taking cocaine, the amount of signal that's passing on is not too many. So they just feel normal. Now what happens, you now tell them not to take any more cocaine, or they are now in a treatment program. So they don't have any more cocaine. They have less dopamine being released into the synapse. And so you have much less dopamine available to sit on these receptors. Mm-hmm. So you have no dopamine signaling going. So what does the patient feel? The patient feels terrible, since they have no dopamine signaling and they need dopamine to function in daily life. And this is when they get cravings. So is that sort of, mm-hmm. Yeah, okay. So this is where taking them off the drug, they just feel terrible. So unless they're able to make more of these receptors or make more of the dopamine, they'll continue to feel bad. So we can see this on imaging. We can see here when these are control people, they have normal amounts of these receptors. We just talked about receptors. And that signal is red. So this is when they have normal receptors. It's in the red signal. And when they've used cocaine for some period of time, they've lost the receptors. I just showed you that. They lose the receptors. So here, someone who's using methamphetamine, same thing, less of these receptors, alcohol, and then heroin. So the addicted brain has much less receptors. So you can actually see this physiologically on scanning, on special scanning. So next I'd like to talk about the root causes of addictions, and maybe if we can look at some of the root causes, we can help repair the brain, help bring back some of these receptors and some of the dopamine functioning. So I'd like to look at nutritional deficiencies, gut-brain connections, methylation and genetics, hormone imbalances, and the social factors in addictions. So if we have nutritional deficiencies, then we won't be able to make the neurotransmitters. So here for the neurotransmitter called dopamine, you need amino acids called phenylalanine and tyrosine. These are amino acids we get through a good protein-rich diet. If we're able to absorb it, then we have these amino acids. We also need vitamins called folate and B6. These are vitamins that our body needs, including we also need minerals like zinc and copper to be able to make dopamine, and in turn to make norepinephrine, which is another kind of neurotransmitter. Same thing for serotonin. Serotonin is made from an amino acid called L-tryptophan. You need vitamins like vitamin D and folate and B6, and you need zinc. So if you don't have these nutrients, you're not going to be able to make serotonin, and hence you won't have the effects that you would if you had normal serotonin in the brain. And here you have studies from the literature that shows you that malnutrition is prevalent among individuals with alcohol and drug use disorders. So here they clearly say that these patients don't have substrates to make the neurotransmitters, and that malnutrition in folks with SUDs promote drug-seeking behaviors and impede recovery. And again, another study that shows that nutrient imbalance is a strong and consistent correlate of both drug and alcohol use. And they state clearly again that it's due to insufficient micronutrients for synthesis of neurotransmitters. And that if patients are able to have good nutrition, it appears to be protective for substance use. Another one where they actually took levels of certain vitamins, vitamin E, C, and A, in drug addicts and found them to be significantly lowered than in those of non-addict controls. And here they state again that consumption of fruit and vegetables, which has a lot of these nutrients, is lower among drug using folks than in the general population. So this is a study that was done among heroin users in a drug treatment program and methadone maintenance therapy program. And they showed here that those who had cravings and a higher risk of relapse had lower cholesterol levels. They actually measured cholesterol levels. So what their conclusion was that we should pay attention to the levels of cholesterol in those going for drug addiction treatment. And in this study, what they showed was that if we did give patients precursors of neurotransmitters, things like phenylalanine and glutamine, amino acid, this is all, tryptophan is also an amino acid, and this is a vitamin, that if we gave patients vitamins and amino acids, this reduced the desire to drink and there was less depression due to the restoration of enkephalins, which is endorphins. So this is another study that showed that if we gave brain-targeted nutritional compounds, that the retention rates for cocaine users in an addiction treatment program improved from 62% to almost 96%. So just giving them neuronutrient therapies. So any clarifications you need?
Oh, I'm just amazed. No, please continue.
Okay, so this is genetics and methylation. So I think if you read the literature, they'll say that 80% of folks with addictions or use disorders have a genetic component. And these are some of the genetics. So here, this is pretty common. This is aldehyde dehydrogenase type 2, for instance, or and here they're actually protective. If you have this, then you're protected from having an alcohol use disorder because you get flushing and you get headaches and nausea. Whereas if you have this OPRM gene, you have less dopamine receptors, and so you're more likely to get an opioid use disorder. And again, directly, if you have lower levels of DRD2 receptors, we talked about this before, and I showed you that picture, those with lower levels of receptors have more likelihood of getting alcohol and cocaine addiction. So some of these so-called genes can be overcome with good nutrition. So it's not all doom and gloom. Like if you have genetics, doesn't mean that we cannot overcome it. With, as I showed you, with good nutrition and maybe specific nutrient therapies, we can overcome some of these issues that we may be born with. Next, I want to talk about the gut-brain connection. I'm not sure if any of you have heard it. It's very common right now about the gut-brain axis. And the way this is modulated is through what are called microbiota. These are organisms we have living in our intestines, mainly the large intestine. And we have many more of these microbiota than we have human cells. In the order of like trillions, we have trillions of microbiota. And what these do is that they secrete certain good things for us that influence the brain. And they can also, if they don't give us good things, that can perhaps influence our brain function. So this is a little complicated slide, but I just wanted to go through it a little bit so that Mr. Pena, you have a little bit of understanding why we need to have like good gut microbiome and why we need to sort of talk about food and nutrition with those who have a use disorder. So on the extreme left in blue, you can see the influential factors, which is our diet. And then right above it is the gut microbiota, this layer, which we just talked about. We have trillions of these. And then we have the good mucus layer, which is protective. And then we have just this one cell layer that actually protects the inside from the outside. All of this is the outside. Everything that I mentioned is the outside, and this is the inside. And these microbiota influence the mucous membrane and things that are secreted that help us, including these signals that we need for good health, cytokines, which are immune regulators, and hormones and neurotransmitters. All of these are very important in maintaining something called the blood-brain barrier. Again, a one cell thick membrane right here that protects the brain from the body. So whatever happens in the body, we don't necessarily want it to go to the brain. We want to protect the brain because it's our master regulator. So this is depicted here. So when you have good, so on the right-hand side, you have pink, which is not good, and the green, which is good. So when you have green, so those are things like probiotics, things like fermented yogurt or kimchi or some of the probiotics we may take, and then fiber-rich foods, fermented foods, beans. So good food give us good bacteria, good microbiota, and that helps have a good mucus layer that keeps this epithelial cell layer intact. If all of this is functioning well, we have good bioactive signals, we have a good, these are neurotransmitters, we have good neurotransmitters, we have good hormone production, and then we have good immune function. So all of these we need to have intact to have a very intact blood-brain barrier. And so that helps us create good neurotransmitters. These are all names of different neurotransmitters. This is serotonin, GABA, dopamine, norepinephrine, glutamate, and acetylcholine. So if our diet is not so good, if we have a lot of high-fat foods or junk foods, we have the wrong kind of microbiota. And these may or may not secrete good things. They might secrete bad things and not the good things. So we have openings in these cells, between these cells. And so what we have is not so good immune system. You have a lot of these things that don't belong, like the LPS, all of these inflammatory cytokines that don't really belong in our body. Or we should have a little bit of it, not too much. So when we have too many of these inflammatory immune dysfunction, we have breakages in the intact blood-brain barrier. And so we have things that are not so good for us going into the brain. Same thing, we have, this is for the hormones, we have not so good hormonal signals going to the brain and coming from the brain to the gut. Again, these are hormones, and this is not so good neurotransmitter signaling going from the brain to the body and the body to the brain. So once we have disruption of the blood-brain barrier, our brain does not feel good. So you have inflammation of the brain. And once your brain doesn't feel good, you may use substances and medications perhaps to make our brain feel better. So this is one of the big mechanisms of having brain dysfunction. So we have here some of the studies from the literature that says that disruption of the microbiomes, of the microbes in our gut, has been long implicated in mental disorders. So this is not just about addictions, it's also about mental health. So it's the same process, because if we don't have good brain function, we may have depression, we may have anxiety, and help us with those, we may use drugs. And here we have another study that showed that if you target the gut microbiota by giving maybe probiotics or prebiotics, we can restore the gut barrier function, we can reduce inflammation, and this could have an effect on the alcohol use and perhaps reducing alcohol relapse. This is another study that shows that maybe in the future, we're not there yet, using specific probiotics, these are names of different probiotics, lactobacillus, bifidobacterium, we can affect different neurotransmitters. GABA is a neurotransmitter, just like serotonin or dopamine. Perhaps in the future, we can give these specific probiotics to enhance function of these neurotransmitters. And so this study sort of shows us that perhaps this is coming in our future.
In our future.
Yeah. So this is hormones and how having hormone balancing is very important for neurotransmitter function. So just very, very briefly, like if you have cortisol deficiency or cortisol excess, it can affect our different neurotransmitters. So this is very important for us to try to balance our hormones to make us feel better. I'm not sure if you've heard, but say opioids, for instance, it's well known that it affects testosterone and it depletes the testosterone. So if you don't have enough testosterone, it decreases our energy level. And so that in turn, if we have less energy, we're going to look towards drugs to give us that energy. So just other ways of how using drugs or even medications can affect hormones, which in turn can affect neurotransmitters. So, okay. So then I want to talk briefly about mental health and social networks. I'm not sure if you've heard about adverse childhood experiences. So it's a study that was done in the 1990s, a joint study between Kaiser Permanente and the CDC. And they measured 10 categories of childhood abuse and neglect. So anything that happened before the age of 18. And so they looked at, as I said, 10 categories, different measures. And what they found was that about 1 in 8 people in America had 4 or more adverse childhood experiences. And if you had more than 4 or more ACEs, you were 7 times more likely to be an alcoholic, 10 times more likely to inject drugs, and much more likely to have attempted suicide. And if you had 6 or more adverse childhood experiences, you were 46 times more likely to have injected drugs. So having trauma, it's called complex trauma in your life, or if you've had it, influences your brain, and it's through the cortisol mechanism. And they've actually done brain scans of people who've had adverse childhood experiences. Again, you can see changes in the brain. Yeah. So I think one of the mottos, if people really understood, if society really understood the close connection between trauma, childhood trauma, and addictions, this would be the motto of our society. Anything that isn't nurturing isn't welcome. Unlike how we're treating addictions right now, which is blaming people and casting them out, jailing them, instead of really like nurturing them. So next, just briefly talking about addictions and mental health. There's a big overlap. About 50% of those with an addiction are said to have a mental illness, so-called mental illness. And about, 1/4 of those with a so-called mental illness have addictions. Again, for me, they're all overlapping. They all affect brain biochemistry. So of course, they're overlapping because both sorts of conditions affect brain health. And so we talked about, the brain, how important brain is in treatment. We talked about mental health and having adverse childhood experiences. Now, just to talk briefly about how important connections are in substance use disorders. So these are rat park experiments that were done in the 1980s by Dr. Alexander. What he did initially was he placed rats in a cage all alone without any other community of rats. He gave them 3 bottles of water, cocaine or heroin, and then plain water. Almost always, these rats, bred and brought up in isolation, always chose heroin and or cocaine over plain water. And they all overdosed till they died. Then he put rats in rat parks where they had access to other rats to socialize. They were free to roam around. They really had like games and setup that were like a rat park for the rats. And these rats were given the same access to either a drug-laced water or to plain water. What they found was that these rats who were given access to both and were in a rat park almost always preferred plain water. They almost never drank from the drug-filled bottle. Even if they did, they just sort of did a sip and they walked away. They never overdosed, never used it obsessively. So it sort of showed the strong connection between having good social connections and how that would help someone beat their use disorder. This was repeated again. This is again in mice and rats. Again, this was just done recently. This was in the 2000s, that when animals were raised in an enriched environment, their vulnerability to addiction was reduced. And that giving these mice an enriched environment during recovery also improved their recovery. So just having good social connections was very, very important for preventing addiction, and once they were addicted, to improve recovery. So this is the biopsychosocial spiritual model for addictions and recovery. At the bottom, you need to have brain-based therapies. You need to correct the underlying biology and physiology. We need to do nutrition replacement, medications if needed, supplements, address sleep, exercise. You also need to have therapies. If you've had trauma, you need to have different kinds of trauma therapies. You need to have CBT, because once someone has had an addiction for some period of time, they have had certain behaviors and ways of thinking that probably needs to be changed. But we can't really, I think, effectively use therapies unless you've really repaired the brain. And then we need for our patients to have good social connections, whether it's through groups, family reintegration, or finding their own social connections. That's also very, very important. And at the top, and I think one of the most important things, is for them to find purpose in their life. Why do they want to be free of drugs? Do they need to have more meditation and help them, go back to the church or have prayer in their lives? So this is my biopsychosocial spiritual model of recovery. And so my conclusion is that several key neurotransmitters are affected by and involved in addiction, that we need to balance and improve the amount of neurotransmitters we have by balancing our nutrients that we take in. We need to have good social networks and mental health supports, and addressing trauma is also a key component to recovery.